Now I want to quickly give an introduction to a topic that will be starting very soon, and this is what is known as a mechanism of normal micturition, cystitis, stress and urge incontinence. So for each of the concepts we'll just have some slides, we'll just talk about it, but of course we'll come back and give in-depth lectures on them, right? So for mechanism of normal micturition, it's just trying to talk about how the nervous system is controlling urination, so it's voluntary, it's reflex controlled, so it's involving the nervous system, it's involving the bladder, it's involving the urethra. Okay, so we have two phases usually: the storage phase, where urine is now gathering the bladder, then we have the voiding phase, where urine is now put out. So for the storage phase, is sympathetic nerves via the hypogastric nerve. Okay, it inhibits the detrusor muscle contraction. So somatic nerve via the pudendal nerve keep the external urethral sphincter contracted. Voiding phase, this is now after everything is done to put out the urine. So pontine micturition center, okay, can I say it? Pontine micturition center is the one that what initiate voiding, okay, if socially appropriate. So if you are not being able to control urine, once it comes, it goes out, then you know that what you have issues from that center. So parasympathetic nervous system stimulates detrusor muscle contraction, external sphincter relaxes voluntarily, okay, then urine will be put out. So cystitis now, which is the next concept we are talking about, is just having to do with inflammation of the bladder. So it's usually caused by bacterial infection. Commonly the Escherichia coli is an organism that is usually culprit there. So bacteria is usually ascending from down up. Okay, so the bladder gets inflamed, there's pain when urinating, urinary frequency and urgency, suprapubic pain, blood in urine, cloudy foul smelling urine, Then stress and urge incontinence now. So stress incontinence is your pelvic floor muscles are weak, so you can have urine leakage. Okay, so urge incontinence is caused by detrusor overactivity and neurological dysfunction. So sudden and intense urge to urinate followed by involuntary leakage of urine. Okay, so for all these concepts we'll just give a briefing about them. We'll come back and make special lectures on each one of them.